All right, so I'm here with John Nutbeam at the CPHC Forum 2016, and we're here talking about health equity. So, Don, give us, I guess, your view on what the health system's role can be in tackling these issues, and within the health system itself, your experiences.
Wow, that's a 40-minute response in the making. What I spoke about this morning was, first and foremost, although all of us understand that to properly tackle inequity in health, we need to address a lot of the underlying social determinants, poverty, education, employment, income. The health system has to provide some leadership around this. It has to be seen to be championing what's necessary to address long-term and continuing inequities in health, and that's really been the theme of today. I spoke a bit about some of my experiences in the UK, and in particular, I think I made the point that there, even when there was a comprehensive response, cross-government response to trying to tackle health inequalities, it was absolutely imperative that the health system was seen to lead from the front. And I outlined a number of ways in which it attempted to do so at the time. A really strong emphasis on strengthening primary care overall, but in particular strengthening primary care systems and services in those areas that have been over the long term underserved, with poorer communities, with poorer access and poorer quality care, and systematically and differentially investing in those areas to improve access and to improve the quality of care. I made the point that over the first 50 years of the NHS in the UK, that health overall had continued to improve in the UK and improved quite markedly over the last 20 or 30 years. But the difference between the richest and poorest has actually widened during that same period, and made the point that although we have a system of comprehensive healthcare both here in Australia and in the UK, that without a deliberate attempt to improve the health of the poorest fastest, the default position is that inequalities in health will continue to grow. And so it requires a very deliberate decisions to favour improving the health of the poorest fastest in order to tackle health inequalities. And that goes for all of the ways in which we organise, operate and invest in our healthcare system. I also made the point it's not easy.
Absolutely right.
The second point I made, so that's just simply about the organisation and investment in the health system. We have to deliberately organise and invest to improve the health of the poorest fastest. Everybody's health can improve, but we need to improve the health of the poorest fastest. Second point I made was some rebalancing in our investment between prevention and treatment, and very clear understanding, I think, that we had in our efforts at the time I spoke about the importance of strengthening preventive actions, particularly again through primary care, using primary care as a major vehicle for supporting people in taking action to improve their health, whether that's to quit smoking, lose weight, improve their nutrition, doing practical things with the local community that made that more feasible. The last key point I made was that we'll make the greatest gains by focusing on within the health system, by focusing on the major causes of premature death among the poorest in our society. And although there are a lot of underlying reasons why these differentials exist, we actually have to make a difference in heart disease and cancer. Because if we tackle inequalities in those two major disease groups in our population will actually reduce inequalities faster and more substantially than through any other actions.
So how successful was this sort of plan, that you were involved with?
Yeah, I'd love to tell you that it changed the world. I made the point in my presentation this morning that we made some lasting changes. Achieving it's probably been the period that I was working with the UK government in the early part of this century was probably the period that saw the greatest expansion in investment in the NHS since its foundation, by ensuring that investment in the NHS was related to need, and by focusing attention on ways in which we could use investment to improve the health of the poorest fastest. I actually think that's been a change that's long-lasting. We were also able to introduce some changes in the government that have continued. So, for example, there's a massive social gradient in death among older people during winter months. And certainly a proportion of this is just simply due to fuel poverty. People can't afford to heat their homes. And the UK during this period introduced a fuel poverty programme which provided additional resources for poorer older people to enable them to heat their homes during the winter. That sort of thing has continued into the future. There's legislation that we were able to introduce during this period to ban tobacco advertising, ban smoking in public places, for example, that is obviously enduring actions we're able to take during this window of opportunity. That said, the nature of politics is as soon as you get a change of minister, and especially when you get a change in government, priorities change. And whilst if you look at the work of the Department of Health these days, there's still a significant focus on health inequalities. The nature of the policy priorities continues to change over time, and I'd be fooling myself if I thought that health inequalities in the UK was getting as much attention today as it did during that period that I was working in government.
Well, inequalities, there's been a lot said about that in the past, week with Brexit and, the role that inequality played in influencing people's decisions. I'm interested in your perspective on that.
Yeah, I think it's sort of too early to tell really what that was all about, but honestly, I do think that it's a very good example of our political class, if I could use that term, misreading what's going on in the population as a whole, and the strength of feeling and the level of concern about a range of things in the population that emerged through the Brexit vote. I have to say I was very surprised, but that probably is a demonstration of how out of touch I am with the feelings of a lot of people who are feeling disenfranchised, frustrated, disempowered, and saw an opportunity to express that to politicians. And I think there's a really, really important lesson to come out of that in democracies, and the one really positive thing to say is that it's been a fantastic democratic process in the UK. In democracies, eventually people find a way of expressing some of their sense of disempowerment and frustration, and I think the Brexit vote was one of those momentous occasions. Probably a monumental mistake. Well, we will, in time, judge it to be a monumental misjudgment, actually, by David Cameron. I don't believe for one moment he and many advising him thought that they would ever lose the vote.
And what do you think about the potential fallout if Britain does indeed leave the EU? What does it mean for health in particular?
Really very hard. It's very hard to say. It would be very hard for me to put my finger on a significant influence of the European Union on the operation of the healthcare system. There are a lot of regulations but I wouldn't like to suggest that they'll all be suddenly undone because we leave the EU, and I wouldn't like to suggest there aren't better ways of regulating and managing the healthcare system that might produce better outcomes for the population as a whole, and perhaps have a greater effect on inequalities. So I'm ambivalent about the impact on health at this point. Let me clarify that. I'm ambivalent about the potential impact on the healthcare system. What I think we have to be wary of is if there is significant long-term economic fallout, then undoubtedly it will be the poorest in society who will, be most vulnerable to a sustained economic downturn in the UK, and as we know, that will have an impact on health. But honestly, it's really too early to say at this point.
And just finally, what do you make of, the NHS was a big thing in the sort of, the Leave and Remain campaign and funding for the NHS, and we've seen the junior doctors strike. What do you make of the current status of play with the NHS at the moment?
So I think they're both marginal issues, if I'm absolutely honest with you. I think there was deceit in the Leave campaign about the impact on funding for the NHS, and Nigel Farage has had to come clean on that since, and it's just muddied the water, to be absolutely honest with you. It's pure politics. I don't think Farage cares at all about the NHS. In fact, if you look into his political history, he's very strongly in favour of the development of the private healthcare system. So it was pure politics, and I've got absolutely no idea whether there'll be any impact at all on the funding of the NHS as a consequence of that decision. What was the other thing you asked?
Just also the junior doctor strike. The NHS has been...
The junior doctor strike is a trade union dispute that has absolutely no relevance to the future of the NHS. They'll sort out their working terms and conditions eventually, but let's not confuse a trade union dispute with the underlying fundamental principles of universal health coverage.
Very well said. Thank you very much for your time. I appreciate that. I'll let you go get your coffee.
All right.